And just talking about anxiety as we would typically see it in pre-COVID times. So anxiety is a normal part of childhood, and every child goes through phases. But children who suffer from an anxiety disorder may experience additional symptoms or increase in severity of symptoms. So when we talk about common anxiety diagnoses in youth, generalized anxiety disorder tends to be what most people think about when they think about anxiety. So generalized anxiety disorder includes our worriers. We typically see at least 6 months of symptoms. So this may include restlessness, fatigue, problems concentrating, being irritable, muscle tension, headaches, or dysfunction with sleep. Another common anxiety disorder is panic disorder. And here we might see recurrent, unexpected panic attacks of abrupt onset. And this may include trembling, palpitations, dizziness, nausea, shortness of breath, sweating, and a sense of smothering or dying. We also see specific phobias. So this is where a child may have fear and anxiety that's triggered by a specific object or situation. And that can be an exposure to it or even just thinking about that specific object or situation. And that object provokes fear. And often it's avoided if at all possible. Often children don't have insight into the irrational aspects of the response to a particular trigger. We see separation anxiety disorder, especially in children. This is where there's an intense fear of being separated from a caregiver. And we may see that exhibit as being homesick, not wanting to attend school, isolating themselves socially, or even in physical symptoms such as somatic complaints like stomachache. Social anxiety disorder, so marked fear or anxiety in situations where there's possible scrutiny by other people. And so fear of acting in a way that would lead to being negatively evaluated. Adjustment disorder with anxiety, and this can encompass quite a few things. Symptoms may include being nervous, being worried, difficulty concentrating or remembering things, or feeling overwhelmed. And then as well, we see obsessive compulsive disorder. So this is chronic and long-lasting, where a person has uncontrollable recurring thoughts and or behaviors that they feel the urge to repeat over and over. So when we think of obsessive compulsive disorder, we may often think of fear of contamination or fear of germs. So anxiety disorders impact between 25% and 31% of adolescents aged 13 through 18. And this prevalence of anxiety disorders, especially among adolescents, is higher for females than for males. But we do often see that anxiety occurs with something else. So it may co-occur with things like depression, eating disorders, or ADHD. So it is very common to see anxiety and depression co-occur together. But it's important to rule out other differential diagnoses of child anxiety. This may include other mental health diagnoses, so depression, developmental disorders, learning disorders, ADHD or ASD. This may also include medical problems that may potentially lead to symptoms that seem similar to anxiety. So hypoglycemia, asthma, epilepsy, thyroid conditions. Medication changes should also be ruled out before a diagnosis of anxiety is made. Substance abuse can be a differential diagnosis, as can psychosocial stress. And it's really important to note that parental anxiety can also be a differential diagnosis of child anxiety. Children often look to their parents to know how to act in certain situations. And so it could be, rather than child anxiety, that it's actually parental anxiety that better describes the behaviors or symptoms that we're seeing. Anxiety may also present as school refusal. So this describes behaviors of children who refuse to go to school or have trouble staying in school. So these might be children who show up to school late because their parents just can't get them out the door and into the car to go to school. Or maybe once they're at school, they're in the office calling their parents saying, please come pick me up. This can be associated with emotional distress, but it can exhibit in the form of physical symptoms as well. So maybe having headaches or stomach aches and saying they can't go to school that day. And it could be related to a number of things. This could be related to avoidance, could be related to escaping aversive social situations or pursuing attention or tangible rewards, especially from parents. And this typically occurs equally among boys and girls. It is not uncommon for us to see anxiety present in this manner as children enter new schools. And so school refusal is often associated with overt anxiety symptoms, such as fear of separation or of transition itself. And school refusal is not a diagnosis, but it's heterogeneous and multifactorial. Anxiety may also exhibit as somatic symptomatology. So internalizing symptoms such as anxiety may exhibit somatically. So stressful social environmental factors are associated with high somatic symptoms among children, which can be further exacerbated by stressful life events. So stressful life events can include things like school difficulties, so starting or changing schools, being in a new environment. It could include difficulty getting along with peers or bullying as well. Somatic symptoms are related to passive or avoidant coping rather than active coping strategies. So maybe the child or adolescent doesn't have the right words to describe how they're feeling. And so rather they just don't want to deal with it, and that exhibits somatically. And so really here we see that a biopsychosocial explanation of symptoms is needed. So when we talk about biopsychosocial, we may see that children are hypersensitive to biological or bodily signals. They may have a difficult time identifying or coping with an emotion and experience modeling of symptoms or secondary gain. And a key to the biopsychosocial explanation of somatic symptoms is to describe that physical symptoms exist and they are affected by psychosocial factors. So how do we look for anxiety? So often screeners are used. One of the most common screeners to use is the screen for child anxiety related disorders, or the SCARED. So the SCARED is a screener, and there's a child version as well as a parent version. And this is looking for how anxiety presents across different diagnostic possibilities. We may also see the Generalized Anxiety Disorder 7, or the GAD-7, used. So 7 questions specifically asking about anxiety. And then the shorter form of that, the GAD-2 as well. And so the GAD-2 specifically asks 2 questions. So over the last 2 weeks, how often have you been bothered by the following problems? So feeling nervous, anxious, or on edge. And then the second part is not being able to stop or control worrying. So even with 2 questions, we're able to assess how anxious someone may be. But again, this is all how anxiety presents and what we're used to seeing. But I want to take a bit and explain our new context. So what are we seeing in the COVID-19 pandemic, and how is this impacting the way that we might see anxiety present? So first, we'll talk about the pandemic as a whole. So at the very beginning of the pandemic, so in the spring of 2020, the United Nations put out a policy brief on the need for action on mental health. So at the very beginning of the pandemic, the United Nations is stating, we know that mental health needs to be a priority. And I think it's eloquently stated here. So although the COVID-19 crisis is, in the first instance, a physical health crisis, it has the seeds of a major mental health crisis as well. Good mental health is critical to the functioning of society at the best of times. It must be front and center of every country's response to and recovery from the COVID-19 pandemic. The mental health and well-being of whole societies has been severely impacted by this crisis and are a priority to be addressed urgently. So this sets the stage for things that we're worried that we might see even at the beginning of the pandemic. And so the beginning of the pandemic, it was stressed that while life-threatening physical health effects may personally impact some, the mental health consequences will impact everyone. And thinking about, the impacts of quarantine and the pandemic and just how that has impacted everyone. And so the impacts on mental health may include a number of things. So we were concerned about increased stress, fear, low self-esteem, disappointment and irritability, helplessness, loneliness, social isolation. And social isolation was one we were immensely concerned about because social isolation can be the precursor to many mental health conditions. So major depressive disorder, anxiety, and suicidal behavior and deaths. And we were concerned about anxiety and depression, PTSD, panic disorder, substance abuse, domestic violence, child abuse, self-harm, and suicidality. And we were concerned knowing that this impact on mental health was going to be seen immediately, but we were worried would last over long periods of time, that it's not something that is just going to disappear. And so there are a number of initial studies that looked at the level of distress in various populations during COVID-19. And so looking at the period of 2020, we were seeing an increase in distress in a number of different countries. And in the United States, we were seeing that adults were more likely to exhibit mental distress than they were in 2019. And so I know we have an audience from a variety of different areas today, but I want to take a moment to call attention to what we're seeing in Kentucky. So the CDC in 2020 began a pulse study. And so they had started to assess in April of 2020, and it's continued in, I believe now we're in the third wave of data, but it was looking to see for adults how anxious or how depressed they were during certain time periods using the GAD-2 and the PHQ-2. And so I want to call attention to a time period similar to now in 2020. So looking at the end of August of 2020, we see that Kentucky adults were reporting high levels of anxiety. And while this has ebbed and flowed over time, if we look at the recent time period in 2021, so looking at the end of August of 2021, we're seeing that Kentucky continues to have a high level of anxiety per adult report. So the individuals in our state are expressing a high level of anxiety. And we know there's going to be distress related to COVID-19. And at times this may be mild and intermittent. And when it is, this would call for things like reassurance and strengthening social support and focusing on relaxation and lifestyle modifications. But when that distress is moderate to severe and persistent over time, this is what necessitates consulting with mental health professionals. And that can be psychological, pharmacological, or a combination of the two. And so when we talk about the role of mental health providers during a pandemic, there are multiple roles. So educating the public about common psychological effects of a pandemic, encouraging health-promoting behaviors, teaching problem-solving strategies, empowering patients with COVID-19 as well as their caregivers, and providing care and encouraging self-care of healthcare providers. And so self-care is something that is so immensely important and something we're going to talk about again during the presentation, but making sure that adults and caregivers and healthcare providers are also taking care of themselves during this critical period. So what were we seeing in regards to the psychological impact of the COVID-19, specifically on children and adolescents? So when we think about overall functioning of youth, we think about, when do children really thrive? So we think about Maslow's hierarchy here and when children thrive. So children thrive when they're safe, when they're protected, when their family and community connections are stable and safe, and when their basic needs are met. But we're seeing that children's lives are being disrupted by the pandemic, and the pandemic is impacting nearly every aspect of a child's life. So their health, their development, their learning environment, their family setting and economic security, protection from violence and abuse, and their mental health. And so we think about how children's and adolescents' lives have been disrupted by this pandemic. So teenagers are no longer able to do the things they were looking forward to for so long. They weren't able to go to prom or to have their high school graduation. They weren't able to attend their typical summer camps. They weren't able to engage in the things that were once so meaningful to them. In addition, health disparities are illuminated. So the pandemic is illuminating systemic health disparities, and it's exposing with terrible clarity the disparities in human society. So racism, poverty, domestic violence, and child maltreatment and neglect. And it typically will amplify the negative impacts that each has on child development and their mental health. It's important to note that younger children are at great risk because high levels of stress and isolation can affect their brain development, sometimes with irreparable long-term consequences. So looking at a number of recent studies, so this one is from 2020, but looking at the difficulties in functioning for youth per parent reports, and this particular study was from Italy and Spain. But if we look at what these symptoms are that are being reported, we see nervousness, restlessness, irritability, and difficulty concentrating. These are symptoms of anxiety. When we think about anxiety, this is what we think of. And so in 2020, parents are starting to report essentially that their children are more anxious than they typically are. Another similar study out of China showed similar things. So children are being reported as being clingy, inattentive and irritable, worried. They're having obsessive requests for updates. They have fear for the health of relatives. And we're also seeing impaired sleep. And so these, again, are what we think of when we think of symptoms of anxiety. And so again, we're seeing from multiple countries, this is being reported that children are anxious. Children are worried, they're fearful, and this may exhibit in a number of different ways. So we know that the impacts on mental health for children and teens are going to include a number of things. So some children are going to cope in a healthy manner, but some are going to exhibit signs of anxiety. So being worried, being anxious. They might be worried about being isolated from family and friends. They might be worried about catching COVID, returning to a new school year or school in a different format, even if those changes are made to keep them safe. We see adjustment disorders, acute stress disorder, or PTSD. We also see depression. So again, anxiety and depression commonly present together. We're also seeing that a number of children are expressing grief right now. That might be grief over the loss of a loved one. That may also be grief over a change in lifestyle or various other presentations. And it's really important to note here that most mental health disorders begin in childhood. So it's imperative that mental health needs are identified early and treated, because if they're untreated, mental health needs can lead to negative health and social outcomes. So we're seeing here that the pandemic is creating new presentations with mental health concerns. And then if someone has a mental health concern, it's typically exacerbating what we're seeing for that existing mental health concern. And so obviously, over the past 18 months, there have been the impacts of a number of things. So there have been impacts of school closures and social isolation. So children have had difficulties accessing their social supports or seeing peers. And it's important to note that many children receive mental health services at school, and because of that, some youth will be disproportionately affected. So 13.2% of adolescents received some sort of mental health services from school. And among all adolescents who received mental health services, 57% received some school-based mental health services. And then 35% received mental health services exclusively from school settings. So it's important to note that adolescents and racial and ethnic minorities with lower family income or with public health insurance were disproportionately likely to receive mental health services exclusively from school settings. And so without those services being offered in the same way as they were when school was in session, they're going to be disproportionately affected by those lack of services. There's difficulty adjusting back to, quote, normal life, and what that looks like. And so I know, kids are back in school now, typically in an environment that might be most similar to what they had pre-pandemic, but it's still different. It's a new normal, and there's going to be some difficulty in that adjustment. Children with special education needs are at risk. So they may become frustrated when their schedule is disrupted. Or, for example, children with learning disorders may not be getting the services that they need to succeed. College students have been, in fact, impacted uniquely, having both an academic and a financial burden. And there are unique challenges for LGBTQ youth as well. So some may have been home from college in a more stressful environment, or some feeling that they were unsafe to return where they had been before. And some children may be isolating in an abusive home. And so the number of mandated reporters who were seeing children during a period of when school were closed and we were seeing more social isolation has tremendous impacts as well. And again, social isolation can be the precursor to many mental health conditions, including anxiety. And so the tool that we've needed to help survive, which was necessary, so school closures served a purpose, but it's going to have impacts as well. So we're seeing that it has negatively impacted anxiety and mental health. So school provides a safety net, and for most children provides much needed educational environment that may not be achieved in the same way with virtual learning. And so again, knowing that social isolation can be a precursor to anxiety, it's really important that we place that emphasis on physical distancing rather than social distancing. So social distancing and being apart from people, we really want to emphasize it's actual physical distancing. So being a distance away from other people, but we really want to encourage social interaction because that's going to help and that's going to be a protective factor for mental health presentations as well. The pandemic has had impacts on child abuse and neglect. And so it's important to note that even before the pandemic, Kentucky has had a high child abuse rate. And so in 2018, it was ranked as number one, unfortunately, for child abuse. And so what we were seeing at the beginning of the pandemic was an overall decline in calls to child abuse hotlines. But we knew that historically, there would be an increase in child abuse and neglect in similar situations, so such as the Great Recession of 2008. And there's a documented increase in domestic violence. And so knowing that there's a documented increase in domestic violence during the pandemic, we also know that children who reside in a home with domestic violence have a 60 times greater risk of child abuse or neglect. And so one possible reason for a decline in reporting, again, is not having access to mandated reporters, but also individuals were at risk for abuse. They had limited travel or access outside of the home. And it's important to note that child abuse and neglect are associated with an increased risk for anxiety as well. COVID-19 pandemic has also had impacts on suicide risk. So knowing that we're likely to see increased suicide rates during and after the COVID-19 pandemic. And experiences associated with higher depressive symptoms can include quarantining, witnessing traumatic events, and fear of risk. And so again, we're seeing fear of risk. So fear and worry is anxiety. And so there's a concern about the impact on suicide risk. So loss of employment and financial stressors are also risk factors associated with suicide. And we know that COVID-19 survivors may be at elevated risk, which is immensely important now that we're seeing an increase in the number of cases for COVID-19 that we're seeing in pediatric populations. It's also critical to point out that the suicide death rate among Black youth has been found to be increasing faster than any other racial or ethnic group. So teens of color have to deal with the disproportionate COVID-19 death toll in Black communities. They have to deal with social isolation, as well as the vicarious trauma which has been experienced. And so it's really important that we recognize the impacts on minority youth during the COVID-19 pandemic. So Black and Hispanic youth are personally disproportionately affected by COVID-19. So we're seeing those physical impacts, but that also makes us concerned for the increase in potential mental health impacts as well. Asian American youth are experiencing increased bullying. And again, as teens and racial and ethnic minorities with lower family income or with public health insurance are disproportionately likely to receive mental health services exclusively from the school settings, they also may be disproportionately impacted by the potential lack of services that they've had over a period of time. LGBTQ students may be quarantining at home, potentially resulting in increased stress. And again, Black youth are at high risk for suicide given the combined stressors of the pandemic and racial trauma. And so we were concerned about a number of presentations at the beginning of the pandemic. We were concerned about increased anxiety, increased depression. And so it's important to know what is the data that's coming out telling us. So we were worried about all of those things. And so what are we seeing now that we're having some data come out from 2020 and the beginning even of 2021, but what are we seeing? And so I want to present some data from a study that was conducted during 2020. But I want to make a note here that the data that we're going to go over in the next few slides is based on insurance claims, but it's based on private insurance claims only. So this does not include publicly insured individuals, nor does it include those who are uninsured. So I just wanted to include that caveat for the data that we're about to discuss. So the data is looking specifically at ages 13 through 18, and it's comparing a time period of 2019 to a time period in 2020. And so what we were seeing is that while medical claim lines we saw were down, mental health claim lines drastically increased from that time period from 2019 to 2020. So we're seeing that people are exhibiting higher mental health concerns during this time period of 2020. We're also seeing an increase in intentional self-harm, again, for the adolescent age group. We were seeing an increase in overdoses and substance use disorders as well. So when we think about the top diagnoses and looking at the age group of 6 to 12, so ADHD is typically the most common diagnosis, and it was in 2020 for this age range. So ADHD is a top diagnosis, but we're seeing here a decrease in claims data related to ADHD during 2020. And so part of that may be that they weren't in the school classroom. So teachers are often a first line for identifying an ADHD presentation, and so that may explain part of that decrease. But I want to call attention here to two diagnoses, so obsessive compulsive disorder and tic disorders, that typically weren't top diagnoses for this age group, that we had seen an increase in 2020 compared to 2019. And so they presented as number 10 and 11 in regards to rank for 2020, but we're seeing an increase not only in tic disorders, but obsessive compulsive disorder. So the safety items that we're putting in place, so washing your hands, using hand sanitizer, being very careful about germs and contamination, we're seeing has for some resulted in a presentation of obsessive compulsive disorder. And so we are seeing an increase in that particular disorder for the time period in 2020. So going back to the adolescent age range, so 13 through 18, we saw a drastic increase in generalized anxiety disorder, major depressive disorder, and adjustment disorders during the time period in 2020. And so adolescents were reporting higher rates of anxiety and depression during that time period. It's important to note other disorders. We did see an increase in it didn't make the top 3 for this particular part, but we've also in adolescents seen an increase in eating disorders. And so likely a search for control when there's not a lot of control in our environment right now. And we've also seen an increase in post-traumatic stress disorder. When we look at ER visits from 2020, we see that while visits to the ER for most conditions have decreased, for mental health claims, it has actually increased in regards to presentations to the emergency department. And so we think about, okay, we have such concern for mental health. How do we make sure that children and adolescents are getting the services they need? And so if we look at telehealth claims data, we're seeing that there is a drastic increase in the provision of telehealth starting in March of 2020. And so it's critical that we have students and youth who are seeking the care that they need for their mental health. And we're able to do that in a safe way. So we're able to provide telehealth. And over time, I think providers and families have gotten a little more comfortable with what telehealth looks like. And this allows us to provide services as well to people who don't live maybe quite as close to an office where they might see a mental health provider, but having access to telehealth has definitely improved over the course of 2020. So talking a bit more about anxiety and what we're seeing during the COVID-19 pandemic, it's really important to remember anxiety's purpose. So anxiety, first and foremost, can be adaptive. And quite frankly, some anxiety is necessary to survive. So anxiety helps to keep us safe or it motivates us, but we do need some level of anxiety. It's just when that anxiety becomes too intense or too impairing that it's a problem. And again, vigilance has been required to respond to continual updates to information. So we've needed to be vigilant in order to keep ourselves and those around us safe. And there's a recent quote from an article by Dr. McBride that I think is quite relevant here. So health stems from allowing fear to protect us from dying, but not allowing it to prevent us from living. So really, we need to have a balance of anxiety. We might need some anxiety to help us and to perform an adaptive functioning. But again, when it's preventing us from living our lives, it becomes more problematic. And so we're seeing anxiety disorders increasing. So we're seeing an increase in generalized anxiety disorder, an increase in adjustment disorder, and an increase in obsessive compulsive disorder. And we're also seeing some interesting things in regards to how worries are presenting during the COVID-19 pandemic. So worry is common among youth currently. So looking during the pandemic, we're seeing worry occur in about 77% of youth. And so this is mostly related to disease or death of elderly relatives, parents, and even the child themselves. So most children were reporting existential worries or worries about the infection becoming unstoppable. But younger children tended to worry more about the long-term impact on their day-to-day life, as well as parental employment. Adolescents, on the other hand, were worried about their own life events that they were missing, so graduation or prom, and they were also worried about their own employment prospects as the pandemic continued. So isolation due to the COVID-19 pandemic is increasing anxiety levels and somatic symptoms in children. So higher anxiety levels in youth are associated with parents being infected or worrying that they would be, being on the front lines or being unemployed. But it's also important to note that youth from lower socioeconomic status reported more fear about physical distancing than did peers from higher socioeconomic status. So families with fewer resources may live in shared communities and be less able to physically distance themselves from others. They may have poor access to healthcare or necessities, have a lower ability to work from home, less access to the internet, and poorer access to social support networks. And this is what is leading to the increased fear. So what do we look for in regards to anxiety? We know that anxiety is increasing, but how do we recognize signs of distress and what that looks like? And it may look differently based on age. So for children, we tend to see tantrums or clinginess, fear of being alone, restlessness, increased crying, fussiness or aggressiveness, stomach aches or headaches, or regressive behaviors. Whereas adolescents, we may see that they're disappointed in the cancellation of events. They might be frustrated or bored, have increased irritability, feel disconnected or isolated from others, have a loss of interest in activities they once enjoyed, or even substance abuse or self-injurious behavior. And regardless of age, we might see trouble sleeping. We might see that they're more withdrawn or have difficulty concentrating. And so taking all of this into account, what can we do? How do we help children and adolescents right now, knowing that there's an increase in anxiety, knowing that there's an increase in distress? How can we help? What do we do? So treatment guidance for anxiety is going to include reducing stress where possible, but gradually and safely increasing exposure. So some of the things we might have recommended pre-pandemic about recommendations for increasing exposure might look differently during the pandemic because we want to prioritize safety as well. So sleep and exercise are critically important. So making sure youth are getting enough sleep, making sure that they're exercising, and consistent routines and preparation. So anxiety comes when we can't explain what's going on and there's not a lot of control. And so anxiety is kind of kids' way of exerting that control or even perceived control. And so having a routine, having something that is consistent and that they know to be something they can count on can help with anxiety. Also, having parents present as calm and in control. So children look to their parents and to adults to know what to do and how to respond in a certain situation. And so treatment for anxiety typically involves cognitive behavioral therapy. So this includes typically psychoeducation, somatic management skills training, cognitive restructuring, so changing our thoughts so that we can further impact our emotions and our behaviors. It includes exposure and then relapse prevention plans. It does also include parental involvement. And so that is very important in regards to the treatment for anxiety. We could also consider acceptance and commitment therapy or dialectical behavior therapy. And it's important to consider how a combined psychotherapy and pharmacotherapy approach may be beneficial, as research shows that a combination of CBT and medication works better for children than either treatment alone. And so medications may work more in the short term, but that therapeutic intervention will have a longer term impact. And so combined, we may see the most robust impact. So resources about anxiety. So it's important to know that there are helpful resources for parents, different books they may find helpful, and then for children and teens as well. So there's a kid's guide to overcoming anxiety. It's called What to Do When You Worry Too Much. Or for teenagers, there's one called My Anxious Mind. And so helping them understand their anxiety as well. And then for mental health providers, the Anxiety and Depression Association of America or the Society of Clinical Child and Adolescent Psychology are helpful websites as well. But specifically during a pandemic, how can families help to support children and teens during the COVID-19 pandemic? And so first and foremost, my recommendation is always to create and enforce a schedule. And so this includes regular sleep and wake times. This includes regular meal times, regular schooling hours, as well as time for social activities or things they enjoy doing. It's important to explain the pandemic in an age-appropriate manner. And as we're getting more information, guidance changes, but we want to make sure that we're continuing to explain the pandemic in a way that makes sense to children. And so being honest, but not sharing too much information that would further increase anxiety. So fostering resilience and providing support is critical. Adults and families can help by modeling positive psychological attitudes. So again, kids are watching adults and families. Diverting attention to more productive and positive direction, like exercise or pleasurable activities. Limiting media coverage is immensely important because too much media coverage can actually produce a trauma response and increase anxiety. So again, it's important to be informed, but not to continue media coverage at all times. It's important to ask how children and adolescents are feeling and facilitate open communication. It's important to listen and validate how they're feeling. And relationships with trusted adults are critical. They provide support and a sense of safety as well. And so I know many of us are well acquainted with this emoji now of wearing a face mask. And so we're used to this being our experience for the past 18 months. And so we read eyes rather than full facial expressions right now. But it's really important to note how we feel under those masks too. So right now we might feel a lot of emotions at once. We might feel relief and anxiety, or excitement and sadness. And it's okay to feel all of those emotions, because there's no rule book for what we're doing right now. And it's hard. And it's important to be kind to ourselves as providers, teachers, parents, or caregivers, and as humans who are going through this incredible time as well. And so I want to end by just pointing out some resources for children and teens that could be helpful. So I work often with adolescents, and what I've learned is they would prefer to text rather than talk, which is fine because we have a crisis text hotline. And so they can text home to 741-741. I encourage all teenagers to have this phone number in their phone just in case they need it. And so are able to text and say, you know, I need help right now. There's also, you can text Steve to 741-741 for young people of color to be connected with an experienced counselor who are better able to speak to their needs at that particular moment. There's a suicide prevention hotline. And then for LGBTQ youth, there's also the Trevor Project, and they have a crisis hotline online via chat as well as via other methods as well. So thank you so much for your time and attention today. These are my references included in my slides. And then any questions or comments, I'm happy to answer those if we have time to do so.
Thank you so much, Dr. Schultz. That was a wonderful presentation with lots of valuable